Hi there. I've been thinking about this transfer of the COVID for a while now, and I noticed that the healthcare workers, they wear a mask to prevent them from getting any COVID, mostly I think to their eyes. Now, even though they wear this shield, the air can flow through if someone's breathing near them, or so it seems that the air is not so much a way to catch the COVID, but the droplets that if someone were to sneeze, they wear the mask to protect from this droplets going into the nose and to the mouth, but a shield for the eyes. Now, if that's the case, and then you have the social distancing, and you also have the washing of the hands. They say wash your hands now. I guess, the transfer, people don't usually stick their hands in their mouth, so if they had it on their hands, I guess they might stick their finger in their nose, but people don't normally do that, and especially now, they probably even less of a chance they're going to do that. But sometimes the eyes itch, it's like, you know what I mean? And people do that a lot, So I think in the eyes, with the hand cleaning, and then the distancing, people staying distance, that kind of prevents the sneezing, and the people are breathing. I suppose if you're standing next to somebody and they're breathing, they're talking, and if you're right next to them and you're breathing in, this kind of thing, you could transfer just with the air. And then if they sneeze, of course, that's going to get in the eyes, and people can probably breathe in. But I mean, usually, like, if you're far enough apart, if someone sneezes, you're probably not going to be breathing through your mouth. So usually people breathe through their nose. So let's kind of almost eliminate the mouth. It's possible it can go, if you're running, it can go into the mouth. But let's just kind of say it's not really going through the mouth. It can go through the nose if you're breathing when someone is talking a lot, or maybe if they're 6 feet apart or somewhere, if they sneeze. But usually if someone sneezes, you kind of stop breathing. You don't go try to breathe it in. So I'm kind of thinking that the eyes is the door to a lot of people, but for some reason they don't say wear protective glasses. They haven't been saying that. There's 3 things: wear a mask, wash your hands, and stay distant. But there should be 4. They should add wear protective glasses, and just like in the hospital, those healthcare workers wear these protective shields. So I'm thinking the eyes. I mean, why are people still getting? There are a lot of people wearing masks, but still some people we're still getting this. It's still in record numbers. That people are getting the virus. So I think someone should do a little research on the people that had. I don't have access to the data, but I'm sure they do, and they probably can sort out how many people with glasses that wear glasses get corona, and how many people that don't wear glasses, how many get corona, and see if there's anything there. Because, I mean, think about it. The healthcare workers wear a shield, but the air can still get behind there. People are breathing. So the shield is to protect from the sneezing. And, if someone sneezes in public, that's going to fly around quite a bit, droplets. The other kind of air particles, if someone's talking, it's not as much as a droplet, going in someone's eyes. And people's eyes are always open, So it's kind of like, the chances of something going in the eyes is more than in the mouth, because the mouth is closed most of the time. Unless, if they're talking, they're not really breathing through their mouth as much. The nose, they can be breathing and then breathe out. So the nose is open like half the time. Now, if the particles fall on the face, of course, like if someone touches that and then rubs their eye or touches that, goes in their nose. But on the face and on the hair, if it's there, it's really not going to go in the body. Now you can buy food at a restaurant, takeout, and eat it. That's okay, but for some reason the coronavirus doesn't stay alive on food, so it probably doesn't stay alive that long, on your face. We're allowed to go get takeout, and no one's saying anything about eating food. So if you think about it, it has to get somewhere in the body that it can, like in the eyes, it can get in there and through the ducts or through their nose. But they're not saying to wear these protective glasses. So someone can take the data and then get that data and see, okay, these people have got corona, all these people that got the corona, which ones wear glasses on a normal basis, which ones don't. See if there's any correlation to if there's less people with corona because of the glasses. In other words, like, do more people get coronavirus that don't wear glasses? Just something to think about. Okay, well, other than that, just try to do what Jesus told you to do and you'll be okay, because he came here to save us. He didn't come here to judge us. Just read John in the Bible and try to do what Jesus told you to do and you'll be okay. God bless you. Thank you for listening.